So what is Botox? Botox is a botulinum toxin type A. And then from there are 5 different brands that are FDA approved here in the US. They can be that they don't have preservatives. For example, Xeomin doesn't have the same preservatives. It can be that are stronger and then they have a different mechanism of action and they can last a little bit longer on your face. So from all these 5, we have Botox, Xeomin, we have Jeuveau, we have Dysport, and we have Daxxify now. So for this type of videos, today we're gonna talk about Xeomin specific. Xeomin cause headaches? No. It's more because the needle prick that goes into the muscle that can cause a little bit of headache. And that can happen with any other Botox product, not just Xeomin. Botox in general can cause a little bit of headache after the treatment, but it's more because of the needle prick. So just because the needle went into the muscle, they can create like a little bit of headache in your face, but it's actually an FDA approved treatment for headaches, especially migraine headaches. In general, why is that the headache happens is because the muscle got pricked. So that needle stimulates the muscle, but there is like a tension happening in the muscle. And that's what we think it's a headache, more because it's sore in that area. So imagine, for example, when you get your blood work done or you get like a prick in your belly, it's sore. And yes, you can have an arm ache, but we don't have a specific word for the arm, like we say headache or like stomach ache. So that's why we say, oh, I have a headache. And it's not a headache in terms of a migraine headache, it's more because of the prick directly to the muscle that creates that tension and creates almost the same as when we call tension headache. Some patients can experience a little bit of headache after a Xeomin treatment, but it's not because of Xeomin or because of the Botox. It's more because the needle prick directly to the muscle create this pressure, almost like a pressure headache. But Botox or Xeomin is FDA approved to treat headaches, especially migraine headaches. So if you have a headache or you experience a headache after a Botox treatment, you can take Tylenol. Tylenol is a pain medication that it's approved for after Botox treatment, and it's not gonna cause any extra bruising. So the best pain medication for headache after a Botox treatment or like a Xeomin treatment is gonna be Tylenol. If you experience a headache after a Xeomin treatment or any Botox treatment, you can just put cold compresses in your forehead. You don't need to treat it with medication because it's gonna go away. It's gonna go away in a few hours. It's not because of the Botox treatment, it's more from the prick. If you worry about headaches after your Xeomin treatment, you can do is either take a Tylenol before the treatment, or another good thing is to drink lots of water. The more hydrated you are, the less probability you're gonna have to have a headache. Sometimes headaches are related to dehydration. And it might be that because you're dehydrated, your veins or your blood vessels are trying to maintain that volume in your body. And when you get the Xeomin treatment or you get the Botox treatment, it's gonna cause a headache. So by hydrating before your Botox treatment, your blood volume in your system is gonna be normal and it's not gonna cause that headache or that tension headache. I have patients that had the headaches after and patients that treat the headache actually after Xeomin treatment. So what do we do for those patients that had the headaches? I like to always tell them to hydrate before, to take Tylenol before the treatment, and then hydrate after. And it usually lasts for a few hours and it's not gonna last. This headache is not gonna last. For patients actually that tend to have migraines, how they discover the treatment of Botox for aesthetic treatment is because it was meant to be a medical treatment for migraines. And when the patients start having migraines, usually how migraine headaches start, it starts in one area. It's always localized. For patients that had their localized headache in their forehead, they will treat the Botox, they will put the Xeomin in their forehead, and they realize that the migraine was gone and the headache was gone, but at the same time the wrinkles were gone. So that's how they discover Xeomin treatment and botox treatment as an aesthetic treatment, because after they treat migraines, the wrinkles were gone.